All right, I am going to kick us off. Good evening, everyone, and welcome to the Barbara Jordan Civic Engagement Webinar Series, brought to you by the National Coalition of 100 Black Women Incorporated, Dallas Metropolitan Chapter. I'm Sonia Irby, and I'm president of the National Coalition of 100 Black Women, the Dallas Metropolitan Chapter. And I'm excited to welcome you to our series tonight. We have a dynamic panel of speakers, and I look forward to giving you the opportunity to hear from each and every one of them. But first, I want to take just a few moments to share a little bit about our organization. The National Coalition of 100 Black Women Incorporated is a 39-year-old advocacy organization founded in 1981. And today we have over 61 chapters and over 3,500 members across the United States. Our mission is to advocate on behalf of Black women and girls to promote leadership development and gender equity in the areas of health, education, and economic empowerment. Our vision is to see Black women and girls live in a world where socioeconomic inequities simply no longer exist. Now, the Dallas Metropolitan Chapter was created in June of 2018. Our chapter was formed by 45 dynamic women whose vision it was to be a voice in the community and address the concerns of Black women and girls in the Dallas area. And we have been working very hard over the past 2.5 years to make that vision a reality. But we don't do what we do without the help of partners, both at the local level and the national level. Our organization partners with companies like the Coca-Cola Company, the Truist Foundation, as well as Major League Soccer. But tonight, I want to turn our attention to healthcare legislation and the impact of our communities here in the Dallas area. This is one of the ways that we advocate, by bringing education and resources and information to the community. So I want to thank each and every one of you for joining us tonight. If this is your first time connecting with us, I encourage you to connect with us on all of our social media channels, and stay tuned for more information for upcoming events like our Sisternomics in series on investing on April 20th. And also we'll be kicking off our scholarship fundraising efforts beginning April 10th, and that'll culminate in a program on April 24th, where we will award scholarship recipients and celebrate our Economic Empowerment Award. So with that, I encourage you to tag us on Facebook, share this live broadcast with your family, your friends, your audience, and ask them to join us tonight. I'm going to turn over to Judge Audrey Moorhead, who'll tell us a little bit more about the Barbara Jordan Civic Engagement Series. Thank you.
Good evening. It is an honor to be here with you tonight, and I'm afraid that in a moment my computer is going to automatically restart. So I'm going to give you this information as quickly as possible. The great Congresswoman Barbara Jordan, for whom our Civic Engagement Series is named, said education is the key to both political and economical empowerment. It is our goal to bring you the cutting edge thought leaders on those issues critically facing our community. This series began last year in 2020, and it is still our goal. And I believe that goal has been exceeded by our tireless and detail-oriented public policy co-chair. She holds a Doctor of Pharmacy degree from the University of Tennessee Health Science Center. She is a former president of the Dallas-Fort Worth chapter, president of Healthcare Business Women's Association, and I'm honored to present to you Dr. Tanzania Vincent.
Thank you so much, Judge Moorhead, and we hope that you will restart your computer and join us as soon as you can, if that happens. Good evening, everyone, and welcome. I'm very excited about this program, and it's my honor to introduce our esteemed panel this evening. And so I will begin with our first panelist, Dr. April Allen. Dr. Allen is actually originally from Tennessee, and so am I, as well as a graduate of the University of Tennessee College of Pharmacy, and so she's also my fellow alumni, so I'm very excited to introduce her tonight. She's been in Dallas since 2003, and she's currently the Anticoagulation Clinical Program Manager at the VA North Texas Healthcare System and is a clinical pharmacy specialist in anticoagulation. She also serves as co-chair for the Veterans Integrated Service Network, or VISN 17, Anticoagulation Workgroup Committee. And this committee works with 7 sites across the state of Texas to improve anticoagulation services. She has a number of publications and posters that have been presented on her work in anticoagulation. Her most recent collaborative VA poster presentation actually won first place in the Texas Society of Health Systems Pharmacists and the TSHP Research and Education Foundation competition in September of 2020. So congratulations for that accomplishment. She received a Bachelor of Science degree in biology at Tennessee Technological University in 1995, and she received her Doctor of Pharmacy degree from the University of Tennessee in 2002 and completed a pharmacy practice residency in ambulatory care emphasis at the Regional Medical Center in Memphis, Tennessee in 2003. She also received several awards, including the Roche Pharmacy Communication Award in 2002, and she received her Certified Anticoagulation Care Provider recognition in 2010. Further, Dr. Allen was an assistant professor with Texas Tech University Health Science Center School of Pharmacy from 2004 to 2011 in the primary care division, and she currently serves as adjunct faculty to Texas Tech precepting residents. She was also recognized by Texas Tech Board of Regents of Outstanding Practice Achievements in 2006 and co-authored a publication on pharmacy students' role in outpatient anticoagulation setting. So I'm very excited. She serves also on numerous boards as well. Treasurer of the Dallas-Fort Worth of the American College of Clinical Pharmacy and chair of ACCP Endo-PRN Networking Committee. And she continues to be an active member of the Texas Society of Health Systems Pharmacists, the Metropolitan Health Systems Pharmacists, as well as ASHP and the Dallas-Fort Worth ACCP chapter. So she's busy, so we're really excited to have her. And I do have to read this disclaimer that tonight she is serving and speaking more as a clinical pharmacist, healthcare provider in the area and not as a VA or federal employee. So welcome, Dr. Allen. Our next speaker is Mr. Kybrin Alexander. Mr. Alexander was born in Atlanta, Georgia, but grew up in Dallas, Oak Cliff, attending St. Elizabeth Hungary Catholic School, Bishop Dunn High School, and Skyline High School. He then attended Hampton University, majoring in political science, before graduating from the University of North Texas with his BA. He attends Holy Cross Catholic Church, the Mother Church of African American Roman Catholics in the Diocese of Dallas, where he serves as a lector, usher, finance team member, and an occasional choir member. He's a proud member of the Knights of Columbus, where he serves in leadership. Mr. Alexander currently serves as the second vice president of the Dallas NAACP and the healthcare chairperson for the Dallas NAACP for the last 5 years. Prior to that, he served as healthcare chairperson for the Dallas area interfaith. During this time with both organizations, he has been a regular vocal advocate for Obamacare enrollment and CHIP enrollment. He also works with Every Texan, which is formerly the Center for Public Policy Priorities, a Texas policy group that advocates for Texas Medicare expansion and the Cover Texas Now network. He also worked with the Greater Dallas Community of Churches and the group Hands Together for Peace. And we're really just very excited to have such a community advocate for healthcare education. And he's also a former candidate for city council. So welcome, Mr. Alexander. We're glad to have you tonight. And then our final panelist is our City of Dallas Council member, Casey Thomas. As the Dallas City Council member for District 3, Casey was elected by his peers to serve as Mayor Pro Tem in 2018. He serves as chair of the newly formed Workforce, Education, and Equity Committee, which is the mayor's top priority for his first term. This committee will be responsible for overseeing the city's workforce development strategy and implementation of the city's resilience plan to make Dallas a more equitable city. He is also chair of the Mayor's Complete Count Committee for the 2020 census. He's responsible for seeing that every eligible resident in the city of Dallas was counted and that the city would receive the resources that it's due following the census count. He also serves as chair of the Housing and Homeless Solutions Committee, where he helped to develop the city's first comprehensive housing policy. He has also led efforts to reduce and end homelessness through the previous Human and Social Needs Committee. He serves on the Public Safety Committee, where he led the council's effort to establish the Community Policy Oversight Board. He also serves on the Government Performance and Financial Management Committee, where he is responsible for reviewing and monitoring contracts for the City of Dallas and outside vendors. He was recently appointed as vice chair of the REAL, Racial Equity and Leadership Council for the National League of Cities. Councilman Thomas is a native of Dallas, Texas, where he was born and raised. He attended Dallas ISD schools and graduated from Skyline High School and received his Bachelor of Business Administration in Human Resource Management from the University of North Texas in Denton. And so, as was stated before, we have a wonderful panel. We're looking forward to a very robust discussion. And without further ado, I would like to introduce this evening's moderator, Ms. Ann Batmus. She's the founder and managing attorney of Batmus and Associates, and she's also a member of our National Coalition Dallas Metropolitan Chapter Civic Engagement Committee. So without further ado, I'll turn it over to you.
Thank you so much, and good evening, everyone. I'm Ann Batmus, and I'm so excited to moderate our conversation tonight with our esteemed healthcare policy experts. You know, without a doubt, healthcare policy and legislation has a tremendous impact on our communities, especially for our Black women and girls. And as was mentioned, that's why NCBW Dallas believes that it's extremely important that our community is well aware and well informed about the government policies, legislation, and actions that affect our health and our access to healthcare. So tonight, our civic engagement discussion is intended to create awareness of new policies and healthcare legislation in Texas, and will also address the impact of health policies, including Texas pharmacy laws and other regulation on underserved populations in the Dallas metropolitan area. So we're going to start off with questions for our panelists regarding the healthcare legislation and the impact on our communities. But I want to also remind the audience that we welcome your questions and encourage you to type in the chat box any questions you have, which we'll try to answer as many as possible during our Q&A session. So please take advantage of that. So before we get into specific legislation issues, I'd like to ask each of our panelists, starting with Dr. Allen, how you became interested in healthcare policies.
Well, good evening, everyone, and thank you for having me. And thank you for such a wonderful introduction, Dr. Benson. And it's always great to run into our fellow UT alumnus out here in Texas. And so my interest in healthcare policy started back in pharmacy school at the University of Tennessee. And as a pharmacist, I realized how much healthcare policies can impact my profession and still impacts my profession to this day, especially with lobbying power when it comes to other organizations like nurses and physicians as well. And as I grew in my career, I further realized that healthcare policy impacts hospitalization days, you can say, insurance rates. It also impacts reimbursement, and also it can lead to healthcare disparities. I've had the fortunate ability to train in underserved areas throughout my career, and work in underserved areas. I did my residency training at the Med in Memphis, and it's a county-based hospital, very similar to Parkland. So I saw a lot of underserved and disparities while doing residency. I've had a chance to go to Arizona, New Mexico, and work with the Indian Health Service and be on the reservation some. And currently I spend a weekend a month working in a retail pharmacy in the Oak Cliff area. And so I get a chance to see a lot of different things within healthcare that healthcare policy can shape. And the one thing I'm telling anyone, that healthcare policy influences healthcare practices, which influences healthcare outcomes, and that impacts all of us.
Thank you. And Councilman Thomas, could you tell us how you became interested in healthcare policies?
Well, first, I want to say thank you for allowing me to participate in this important and timely discussion as it relates to healthcare. When the city of Dallas first got impacted by COVID-19, that required the city to take action. Here in the city of Dallas, we have a interlocal agreement with Dallas County Health and Human Services, which handles majority of the health issues as relates to the city of Dallas. However, with the impact of COVID-19, the fact that we had to look at the economic impacts of COVID-19, it caused us to get involved from a healthcare perspective. Our mayor appointed me as one of the chairs of our COVID-19 ad hoc committee on economic recovery. And so for the first several months, I was focused on looking at the economic impact, how our small and local businesses were impacted, and how our revenue for the city of Dallas, which comes from taxes, would be impacted. After several months, the mayor appointed me chair of our COVID-19 ad hoc committee for economic and social recovery, merging two committees together, which required me to get more hands-on involved as relates to the positive COVID cases that were happening. One of the zip codes that in my council district, 75211, zip codes predominantly Hispanic, but it had the highest number of positive COVID-19 cases in Dallas County, not just the city of Dallas. And another zip code in my district, 75216, which is Oak Cliff, which is predominantly African-American, was in the top 5. And so we began working diligently to advocate for local COVID-19 testing sites, because we had lack of PPE, and we also had no COVID-19 testing sites in the southern part of the city. And once we were able to get more sites set up, shortly after that, then vaccines became available, and we were dealing with the same challenge and issue of not being able to sign up to get the vaccine. And so my involvement is from a healthcare standpoint, started with COVID-19, is continuing with advocating for equitable distribution of the vaccine and for registering individuals who don't have access to technology for the vaccine. Access to the vaccine is the beginning of the end of this pandemic.
Right. Well, thank you. And Mr. Alexander, how did you become interested in healthcare policies?
My interest actually started back in 2011. My mother was having knee replacement surgery, and there was a certain amount of coordination and the absence of coordination. That was when I moved back to Dallas from DC, and I ran into one of my classmates who was 9 months, she was just into a new job that had a 9-month probation period before she got healthcare benefits. I was very big on Obamacare at the time, and I just thought that was crazy that she had to wait 9 months to get her healthcare benefits. And she was diabetic with high blood pressure, and shared with me that she was dizzy going to and from work some days because she had to take her 30-day allocation of medications from Parkland and attempt to stretch those out as long as she could. And some days it was worse than other days. That then got me very interested in, well, how do we improve things like that when we have medical deserts on my side of town, We've got doctors that cluster around hospitals, but the community that actually needs them doesn't really get to develop that relationship with the doctors. And they need that relationship way more than they need the density of fast food places that seem to be so prevalent in our parts of town. Mm-hmm. So unfortunately, that same friend just passed from COVID after a maligned health reality. She just recently passed this year from COVID. And it's not my life's mission, but it is important to me to make sure we don't have any needless suffering from people who could have been insured, could have had their business handled a whole lot easier if there was some common sense approaches to making sure everybody had health care and it wasn't this cash cow that it's been for the longest time. And I'll leave it brief there and we'll get to it later on.
Oh, thank you. And my condolences to you regarding the loss of your friend. So it's clear from what we're hearing from all of you that there's a lot of issues, healthcare issues affecting our communities. And I want to thank you all for your advocacy work in these areas. So now I'd like to discuss another very important healthcare issue, we believe, for Black women and girls, and that's maternal health. So I went online to search any new legislative efforts on maternal health in Texas, and I found dozens of bills for this 2021 session. And by the way, for the audience, I wanted to let you know, you can go to a website called www.legiscan.com, and you can get details on any active bills in the Texas legislature. So, you know, for those who are interested and understand the impact of how the law affects us, you definitely want to check out that website. But even finding out about actually the potential impact of those bills really requires experts like our panelists. So I want to ask each of our panelists for their view on any specific noteworthy legislation, either pending or past this session, particularly related to maternal health care. So starting with Councilman Thomas, from your point of view, what should we know about healthcare legislation that regarding maternal health and the impact on Black women and girls?
Well, one particular piece of legislation, and I don't know the number that it's been filed under, that is extremely important, is bringing back the office as relates to addressing minority health. That's critically important. Back in 2017, they through the budget, they did not continue that office for funding. That office was available to look at disparities as relates to healthcare when it comes to ethnicity, race, gender. So if we would still have that office today, and that office was still open today, we would have immediately been able to identify the disparities as related to COVID-19 testing, those who were testing positive for the virus, and things of that nature. And so when we talk about being able to adequately use data to make decisions and to drive policy, then reestablishing that office is critically important. So I encourage everyone to advocate for that bill in particular. And like I said, homework. Things are moving really fast in the legislative session. Things start out real slow, then all of a sudden they pick up really fast. And so they're having hearings and on bills as we speak. And so we want to make sure that we can let our state representative, let our state senator know that we want to see this bill passed and this office reestablished so we can be able to have data that can help us make decisions as relates to our healthcare, as relates to African-American people, as relates to Black women, as relates to girls.
Oh, thank you. That's definitely one to take note of. We will, excuse me, definitely check that out. Yeah, it's definitely a very important point. Dr. Allen, what about healthcare? What specific, or any specific healthcare legislation regarding maternal health that interests you or that we should know about?
The recent changes in Medicaid when it comes to Planned Parenthood, and that not the coverage is being taken away, the funding of that. And in 2019, over 8,000 women utilized Parent Parenthood services in the state of Texas, Medicaid. And that includes coverage for contraceptives for women. That includes screening for cervical cancer, breast cancer, HIV. And so taking away those services and the funding for those services through Medicaid is going to be very hard for women of low socioeconomic standards, which are mostly, they use Planned Parenthood, are women of color, Black women, Latino women. That is a huge service to take away, basically. And so when you have to go to another doctor that you're not used to, that is a major change in getting to establish a relationship. And on top of that, a lot of doctors do not take Medicaid because of low reimbursement in the state of Texas. And we're one of the lowest states for our cost of Medicaid in the nation. So that's one of the things that kind of stood out to me when it comes to thinking about women in maternal health, because that is a huge component, not having Medicaid not cover that service anymore.
Thank you. Mr. Alexander, any healthcare legislation of particular interest to you as well?
Representative Rose has filed a bill that would extend postpartum care for the mother to for a minimum of 12 months. That's extremely vital. And Representative Sherman has also filed a bill to create a maternal mortality task force. That will also go a little bit to what Casey just referenced, but the 800-pound gorilla in the room is Medicaid expansion. And let me explain some things that a lot of people don't know. In the state of Texas, in order to qualify for Medicaid, you have an income requirement that must be no more than $7,500 a year as a parent. If you are a childless person, you are not eligible for Medicaid, period. If you, in one of the hot spots in the city of Dallas is the Lancaster corridor, #1 area for stage 4 undiagnosed breast cancer in the county. It heads down into Lancaster, Cedar Hill, DeSoto, Duncanville. We have too many people that have income issues, have health concerns that are genetic, that are induced because of food and other things. And we don't have the facilities present to address what we know is a ticking time bomb. Pair that with the doctors require payment, but I don't make enough money to do my life requirements and make it to the doctor. So, but for a free clinic or a free mammogram van, a lot of people don't get their prostate checked, don't get their breasts checked, don't have the intervention for prenatal care, but for free options that are available through Parkland's clinics. Baylor has an interest, Presbyterian has an interest, Methodist has an interest, Parkland has an interest, but we can't get people to the facilities without money. Medicaid expansion would allow a lot of people who currently are afraid to go to the doctor to find out what it's going to cost them to just get diagnosed and find out whether they're okay or not, and then get the services that their life is about to require. So your requirement is no more than $7,500, but minimum wage starts at $15,000. So you got a gap of people who have no options for coverage that don't then take away from gas money, from food money, for other living expenses. And when you're asking people to make life choices, they're going to go with the day-to-day over the, it'll wait. And then by the time they find out, it requires something very severe, like an amputation. It's so severe, and oftentimes it's too late for the medical staff to do anything, so they have to make them comfortable because it's just a matter of time before they expire. This is a public policy matter that the state of Texas has passed on since 2011. So for 10 years, they've been saying, oh, we don't need to worry about it. We don't need to worry about it. One of their excuses was, we'll wait till a Republican administration is in so they can reimburse us and make it easy for us to come in. That time has come and gone. No change. So we have to start speaking up for ourselves, for our community, for our Hispanic sisters that are struggling in the Valley with no healthcare coverage, no hospitals, and very little effort to come remedy that area of the state in terms of their healthcare needs. And I'll just keep that right there.
Well, yeah, it's obvious. I mean, it's apparent. It's so eye-opening that there's so much lack of access, lack of healthcare availability. And thank you for all of you for providing that information to us. So following up with you, Mr. Alexander, Dr. Allen actually mentioned this about Planned Parenthood and some of the issues and access there. But over the years, we've heard a lot about legislation in many states, including Texas, related to Planned Parenthood, which provides healthcare services to underserved communities nationwide, particularly for maternal health services. In your view, what are the misconceptions about legislation regarding these services by Planned Parenthood?
There's an overemphasis on the abortion services that are available through Planned Parenthood. It is a disproportionate emphasis. If you listen to certain legislators, they make it sound like abortions are all that Planned Parenthood does. But when you go to the clinics, you get a much fuller view of the range of services that the people who are without require, that only Planned Parenthood is able to do efficiently, effectively, and with the arms of the medical establishment, who will find a way to make sure that certain things get to those Planned Parenthood clinics for the health of the community. So when you're dealing with younger women who are often victimized by older men in the neighborhood, in society, one of the ways that you can combat the rumor mill of what's effective, what's not, what do you need to do, what is to have those classes at Planned Parenthood. And you develop a network of truth that if you have any questions, you have any concerns, this is confidential. You can come to us, get the information, make the decision you're going to make that's best for you. And it does not always involve a pregnancy, but there is a lot of work that deals with pregnancy prevention. And if the young woman happens to be pregnant, then what are the planning services that you wish to make yourself knowledgeable of and avail yourself of? Nobody's forcing anything, but if you listen to the misinformation that's put out by certain legislators, it's a grease slide to abortions, and it's not necessarily that. That's what the biggest misconception I can think of.
Thank you. The misinformation is really a big problem in a lot of areas. So thank you for clarifying that. And that's something we all need to make sure that the right information gets out there so that our legislation is appropriately reflects our needs. So now we're going to turn to public health policy nationally. And we've all been affected, as Councilman Thomas mentioned, in one way or other by this public health crisis of COVID-19 for the past year. And the health and economic impact appears to be hardest on underserved communities in particular. So I have a few questions for each of you on the COVID-19 pandemic. Let's start, and actually anyone can jump in. What impact to the economics in the African-American community, particularly women and girls, have you seen because of the COVID-19 pandemic and quarantine? So
I'll go first.
Okay.
A year ago, it's hard to believe we've been in this space for a year. A year ago, we began to look at what the projection of the economic impact of COVID-19 was going to be specific to the African-American community, I partnered with the Dallas Black Chamber of Commerce. And the first time ever, we had 3 Black economists, 2 males, 1 female. And they all looked at, and it was a phenomenal conversation. We did it by Zoom, of course. We had a virtual conversation. But we looked at how the African-American community was projected to be impacted by this virus. McKinsey did an excellent study. They had their Black employees to do a study on the economic impact of the Black community. And one of the things that really stood out and something we need to be mindful of, not just now, but as we begin to look at what a post-COVID life for Black folks is going to be, is the service industry was impacted more than any other industry in the country. Why? When we talk about Black people, when we look at those who are not degreed, those who are blue collar, they work in the service industry. They're the ones that are taking our orders at the restaurants. They're the ones that are fixing us drinks behind the bar. They're the ones that are providing soap, grocery stores. When we go in the grocery store, they're the ones who were living dangerously when all of the non-essential services were shut down. Grocery stores were still open. Our healthcare professionals who are working our age, those individuals were living dangerously. There was not a vaccine at that time. They had to make sure they had masks. And we saw all across the country, not to mention here in the Dallas-Fort Worth Metroplex, there were individuals who did not have enough masks, PPE, that was available, and they were actually working as healthcare professionals. And so our community and our women in particular were impacted, especially those who worked in the medical profession. And so that was very, very important information for us. But going forward, we have to look at what does a post-COVID world look like from an economic standpoint for our community. This is the time to get advanced degrees. This is the time to get an associate's degree. This is the time right now when the ACT, SAT is not required. GRE, if you're looking to get a master's degree, is not required at this time. This is the time for us to be preparing ourselves for the opportunities that are going to come later. I heard someone say this, and I've taken ownership of it. Those individuals and those companies that are positioned well coming out of the pandemic will be the ones who will benefit going forward.
Absolutely. Does anyone else want to weigh in on that?
I'll be happy to weigh in on that. And thank you, Councilman Thomas, for recognizing the plight of healthcare providers. And I can tell you it was a scary time being a healthcare provider and just trying to adjust to the world of COVID that we've been in now for a year. You hit on a spot that's one of the first that I think about when we talk about the first responders as far as healthcare providers, but we also got to talk about people in the service industry, because these were people who can stay home. And I remember we were deploying people home as quickly as we could deploy people home to keep them safely. But the young lady that's the cashier at the grocery store, the people at the movie theaters that works there, people in the gig industry, anyone who could not work from home was severely impacted. It was mostly people, women and people of color, basically. And not everyone had a job in the banking industry or IT or in the healthcare jobs where they could be at the house for different things. So just to echo what Councilman Thomas said, it really was a huge economic impact, because you got to think about the fact that you had people trying to go to work ill, spreading this disease, just because they wanted to make sure that they had enough money for food on the table and things of that nature. And so the economic impact was huge when you look at COVID, businesses being lost for people as well too. And so it was one of those things for the economic impact we may see for years to come. And then things are just now starting to come back. But the biggest thing that I saw was the people who could be at home and people who could not be at home. And then those that were even at home struggled some just because of childcare issues and trying to teach their children and work at the same time.
Yes. Yeah, the impact is, I'm sorry.
The impact that I want to dovetail on, think of all the beauticians that had nowhere to go for months, and they were backdooring clients that they knew they weren't supposed to be seeing, but their economic reality and the vanity of some of their clients mandated that they had a stream of persons, even if they winnow the traffic in the shop down to 1 or 2 persons at a time. The fact of the matter is, we had a community that was literally taking their lives in their hands on a daily basis for the purpose of making sure they maintained income. They did not have the option to remote in. They did not have telework available to them, nor did they have it available for their kids, because the infrastructure in the city of Dallas, in Dallas County, is not equitable across the board. I think that's the safest statement. South Dallas has abominable internet service. And depending on where you live in Dallas, the high-speed options that Spectrum and AT&T advertise have not made it to this side of town in 10 years. So we should have some policy that mandates that when they implement a new service, it's got to go citywide within a period of time that we deem reasonable. We cannot afford to have people risking their lives, carelessly exposing other people to life and death diseases because they have no other economic security. And so if we're really going to tackle this, in my personal opinion, there should be a special session that's just around the epidemic so we don't run into the same mistakes where the state was caught flat-footed with unemployment, where the state was caught flat-footed with inspections, where the state was caught flat-footed with driver's license renewals and vehicle inspections. And we have no other alternative, but we're insisting that everything continues to happen. Nobody was looking out for warehouse workers. Nobody was looking out for meat processing staff. And they were some of the quickest and most dense in terms of percentage to get ill within the state of Texas. But we wanted to gloss over them if they were cutting beef and chicken and pork. As long as everybody's eating their ribs at wherever you're picking them up from. But we had entire entrepreneurial Black-owned businesses that were not able to make the adjustment to pure takeout as their business model, and they had to close. What's the impact on their credit? Even though the CARES Act was supposed to provide money to these small businesses, it got gobbled up by the big ones that have Wall Street accounts. But the Main Street accounts got left behind, and nobody's talking about them today. But they want to talk about freedom as now the governor jumps the gun on lifting the mask mandate, and people want to walk around doing whatever they want to, but we cannot afford to be that reckless with our lives. But we have to be exposed to people who are absolutely careless about our lives in policy and in practice.
Thank you, Mr. Alexander. It's definitely clear that there's a lot of lack of resources that we've experienced during this pandemic. So Councilman Thomas, if you could just briefly explain what resources are now available to the communities through the COVID relief package.
One of the most historic pieces of legislation to pass will be the American Rescue Plan of 2021. One of the reasons I say that is because so many dollars that are going to be made available to cities, states, and communities, those dollars will go toward businesses in our community. They will go toward community centers in our community, community health centers in our community, because it was intentional. That's the key word, intentional. They were intentional when they wrote this legislation to make sure that they used the type of language that would benefit African American and Latinx communities that have been historically underserved. Because the dollars now are coming from the Treasury, on a city and state level, there are no restrictions on those dollars. The CARES Act dollars were limited specifically to providing COVID-19 testing, providing retrofitting for buildings and things of that nature. But these dollars don't have those restrictions. Let me tell you why that's important. One, because now cities can use these dollars to make up for the revenue deficit that's going to come as a result of our businesses that won't have the tax revenue that they've had in the past. Two, these dollars will allow us to provide more support, more funding for rental assistance, utility assistance. We can't forget, less than, it's been about a month now, maybe a little bit more than a month ago, we went through one of the worst winter storms probably in the history of the state of Texas. The entire state was almost blacked out. We have individuals to this day who still do not have access to water, whose pipes are still busted because we don't have enough plumbers in the state of Texas to be able to repair the damage that was sustained. So now we can use dollars to support rental assistance, home repair, because there are not restrictions on those dollars. Secondly, we talked about, my college classmate here, Kybrin, talked about the digital divide. He used the term, but he talked about the digital divide. How many households do not have access to technology? Now, cities like Dallas, who's on the cutting edge, are now making it available. We're setting up not just mobile hotspots, but we're actually setting up Wi-Fi in locations, on buildings, on street posts, where individuals in those areas can get access to Wi-Fi without actually having to be in their homes. So these dollars are available now to make not only generational changes, but now we have opportunities to break generational cycles of poverty if we use these dollars and use them intelligently. My last point is, in the city of Dallas on yesterday, we took a historic vote. I chair the Workforce Equity Committee for the city of Dallas. We voted unanimously on a resolution of racial equity. What that means is every policy decision, every funding recommendation has to now go through a racial equity lens. And that's going to make sure that those communities like ours that have been historically overlooked will now be first instead of last. Why was that important and the timing of it? Because in the next few weeks, we will be receiving the city of Dallas's portion of the American Rescue Plan for 2021. The city of Dallas is projected to get between $377 and $400 million. We can help a whole lot of people, and with a focus on racial equity, we can help a whole lot of us.
Thank you so much. Definitely, it's good to see that this legislation will have a good impact and the things that the city of Dallas are doing as well to help us in this situation. Before we go on, or before we kind of end, I want to remind the audience that we are available for questions. You can put questions into the chat. And in fact, because we just have about 10 minutes left, if it's okay, I'd like to just go ahead and entertain some of the questions that we have from our chat, from our audience. So one of the questions we have are, what are the impacts of public policy and healthcare legislation on veteran affairs? Whoever's comfortable in answering that.
I guess that would probably be me. Right. The impact on veteran affairs is a little bit different than the average public just because of the type of setup that it is. And so with that being said, we do have federal laws that impact veterans that may not trickle down to just the to non-veterans, and basically, and so the impact is similar, but you have to look at it with a different lens at times, just because we do have things like the Mission Act, for example, where veterans can step outside the VA to get care that they need if we cannot provide those services within the VA system. And so that's been one of the biggest things that has changed in the past year. And so we do see some outsourcing that is going on, and that is being paid for by the federal government at times. But we try to keep as much as we can in-house as much if possible. So hopefully they help to answer that question some. Similar but different depending on the situation.
Thank you. So another question we have is, how do we assure that the funds provided by the COVID Relief Act aren't gobbled up by those who actually don't need it or are taking advantage of it?
I'll just offer, the best thing we can do is sign up people who need the funds. Unless we're going to be a compliance monitor on the loan side, where we're chasing after something that looks fishy, our best effort is to really help the people who need it sign up for the money that they absolutely require. And so the more of those people that actually need it, that are in the applicant pool, it leaves less room for the people who don't need it to make it through the cracks and get money. That's what I would offer.
Thank you. So I don't see any other questions in the chat. If anyone has a question, now's the time to put it into the chat. In the meantime, we'll go on to another question. If we could go to the next slide, for Dr. Allen. Dr. Allen, from the perspective of a healthcare professional who attends to healthcare issues daily, what do you believe, or what do you feel is the biggest challenge that you face that should be addressed by the Texas legislature?
Looking at regulatory things, evaluating what we call PBMs, pharmacy benefit management companies. And pretty much they are kind of like the middleman. They kind of work between the insurance company, the patient, and the pharmacy and the manufacturer to help set drug prices. And so in the process of doing so, they do get discounts for drugs, but they pass that discount and cost on to the consumer. So when people go in to buy their medication and they're expensive, these are things that could be impacted by these PBM, and they're not very transparent about how they're setting these prices, and also too with the rebates that they're getting and holding back on. There's a bill right now in the Texas State Legislature in the House, I think it's 1093 or 1092, if I'm not mistaken, that's looking at evaluating PBMs and trying to regulate PBMs some. And so that would be very helpful. We can get more regulation with those PBMs, and it may drive down drug prices some to help people out.
That's interesting. So I think we have another question from the audience. What are some strategies being implemented to combat unconscious bias in healthcare?
Well, one thing is that a lot of healthcare facilities around the country are starting to set up boards or committees that look at diversity and inclusion. And so they're starting to have difficult conversations and talking about things of this nature of healthcare bias. And currently I co-chair a committee for the Anti-Coagulation Forum, which is a national organization of pharmacists, doctors, and nurses. And I co-chair a committee called the IDEA Committee for Inclusion, Diversity, Equity, and Allyship. And we're starting to have these difficult conversations about how do we get around healthcare disparities and how do we not have biases? And we're in a meeting today. And this question is very timely because You have people that are very biased, not when we see some providers because of the color of their skin. And we were just talking about having a whole seminar about telling our stories, things we've had to do to get around these unbiasedness type situations here. And I think it just starts by really having open conversation. It starts by letting people know that you're qualified to take care of them, and then just really just earning people's trust along the way.
One of the things that the Affordable Care Act, or as many people know it as Obamacare, required as part of the legislation was the study for disparate impact in communities. And that's helped to sunset the legislation that Casey referenced earlier, because what was supposed to happen, the feds didn't trust the states to document their own incompetence when it came to communities of color. So they said, well, we'll come in and make sure that an objective neutral party gets to come in and document why this doctor only has Black patients on Friday and white patients only get seen Monday through Thursday, as an example. And that happened in East Texas all the time. So when we have these types of impacts that are supposed to be documented, the state leadership in its defiant disposition says we don't want the feds telling us what we need to do because we know we're doing wrong. We know we're doing wrong to communities that exist in these walls, but we don't want the education to get where it's supposed to be. We don't want the health to get where it's supposed to be, because we ultimately want to take anything that is going to be a benefit to us economically over the interests of the humanity that happens to exist on that plot of land in that particular venue. And when we get that type of policy maker that ascends to the governor's office or the lieutenant governor's office or the speaker's seat in the legislature, the policy that then comes out of that shows so much indifference, and we get caught up in our routines. We're so busy functioning and covering the bases we have to cover for the people in our immediate household and extended family. We don't have time to pay attention to everything that's going on in Austin until Casey, myself, and some other people bring it to your attention. And now that we're bringing it to your attention, my question is this to the audience. For all of the stuff that you said you couldn't do, you didn't have time to do, in 2019, 2020 showed you a whole lot different. You had to adjust, you had to be agile, you had to literally make substantive changes in your routine to deal with the new reality. We've got a new reality now with this legislation that's coming through this session. What are you prepared to do in terms of your own advocacy with your own networks that helps the lives of not just the women that we know, but by helping the men that may be adding to the financial base of the household, by adding to the children that aren't taxing the household dollars anymore? We have an opportunity to really help establish a baseline that is going to allow a lot of families to survive better. And are we prepared to do that as individuals?
Well, that's the question. Thank you so much for that. We're pretty much at our time, and we could go on all night because there's so many things to address, but I want to thank you all for your advocacy, your support, the work that you're doing, which is very, very important. Thank you so much for being here tonight and informing us of so many issues and actions that we need to take to support your efforts, and as well as continuing on our own as well. So thank you so much. I'd like to turn it over to our first VP. Thank you. Thank you.
Thank you, Coalition Sister Badmus, for that great moderated conversation. I have been sitting back here in awe. I grew up in Dallas my entire life, and I have learned a lot tonight that I was not aware of myself, and I don't mind admitting that. Thank you to our panelists, Dr. Allen, Councilman Thomas, Mr. Alexander. Thank you all so much for sharing your knowledge with us. And like you said, Mr. Alexander, for opening our eyes and asking us what we're going to do, because that's what we're going to do as well. We're going to ask the community, what are we all willing to do collectively? On behalf of our chapter president, Ms. Sonia Irby, myself, our committee chair and co-chair, Dr. Burns and Ms. Benson, we do graciously appreciate the time that you have taken to spend with us this evening and educating us even more on the healthcare disparities, particularly in the legislation in Texas. And at this time, we want to also issue our own call to action, our own charge. Again, as Mr. Alexander said, what are we all going to do to help advocacy priorities forward in our community? You all have already dropped a lot of nuggets that we can pick up and run with. There's a lot of legislation that you've already mentioned this evening that we will definitely continue to share so that all of us stay informed, but that we also start advocating on behalf of each other. What ways are you going to stay informed and involved? And then we do want to ask how you can continue to partner with us, the National Coalition of 100 Black Women, Dallas Metropolitan Chapter. So we want to leave you with those things. On the screen, you can also see all of our social media. We do invite you, our audience, to continue to follow us on all of our social media. At the end of the close of this particular presentation, and this is the first in our 2021 series, so please continue to follow us, because we're going to continue to bring you great conversation, and we're going to continue to pull the wool up all of our eyes. We are not afraid to have the hard conversations. We had a great start this evening, so I know it's going to get even better. But this is the first in our series. Please continue to follow us on all of our social media so that you will be notified when we have our next series. We also are concluding our economic empowerment series in April. So there is another presentation coming up there, and you won't want to miss it, because it's actually talking about how we perpetuate wealth in our communities through investing and saving. Good segue from this conversation. And then I do want to mention that there are just a couple of days left. If you know a young lady, and I know all of us do, right? Because we all need money, right? But if you know a young lady in Dallas County that is graduating this year, please encourage her to apply for our scholarship. We have 2 scholarships that we will be awarding during this particular season. If you have your phones, you can quickly scan the QR code and be able to send that application to anyone that you know who may be eligible. Again, we appreciate everyone tuning in this evening. Continue to follow us, and we do hope that you have a great evening. Thank you and good night.